Wonder what is revealed in dental photography that is often missed in a routine dental appointment? Hi, I'm Dr. Agatha Biss. In this video, I will show you 7 things that can make or break the outcome when planning cosmetic or restorative treatment. I'll also go through cosmetic smile design and why taking photos is an invaluable tool to a beautiful and natural smile. This video will outline step by step where to start and how to sequence smile design so that we not only get the best outcome, but anticipate challenges along the way. Many people wonder why we take this photo. This shows me where the shoulders sit, something I would never see in a typical dental picture, which is usually close up and focused on teeth only. And when the patient's sitting in the dental chair, you'll often miss this important key element. Where the shoulders sit and presence or lack of symmetry, one side higher than the other, often reveals an underlying temporomandibular joint issue. If one of the shoulders is raised, there's often a misalignment of the jaw on the same side, especially in a symptomatic patient. In a side view, I'm looking at head position as related to restive posture. Patients with a forward head posture often have retruded mandibles, meaning the lower jaw is too far back. This is an important photo when considering any kind of cosmetic treatment like veneers or crowns on the front teeth. When patients ask me to improve something about their smile, this is where I begin in order to plan options for treatment that will give the patients the best results. This photo shows me their current tooth position and where to put the teeth when we go to restore. In a smile photo, you want to see teeth showing, but you don't want to see a lot of gums. If you see lots of gums, then you end up with a gummy smile, which is something that many people want to change. This photo shows me how much the upper lip moves when smiling and will help me determine how much tooth will show as well as how much we want to show. This photo will ultimately act as a guide so that when we design a smile makeover, we end up following the general outline of the lower lip. This photo helps me determine if the patient's upper and lower jaw are in the correct position. There are times when a patient does not like their smile and wants to change it, but the reason behind it has nothing to do with the appearance of the teeth and everything to do with the position of the upper or lower jaw. A retracted photo gives me way more information when it comes to gum line and position. In an ideal situation, we want the tissue level same at the canines and centrals and slightly lower on the laterals with symmetry. I can also see what's going on at the gum line on the teeth themselves, so if there's anything there, we can address that before deciding on which teeth to actually fully restore. And of course, full arch photos tell us a ton of information because you can see all the teeth in each arch at the same time. So any fracture lines, broken fillings, or decay that dentists see, we can now show to the patient. In addition, this photo tells me the arch shape. So for example, someone has a narrow arch and an undiagnosed breathing or sleep issue. Expanding the arch may help resolve not only the aesthetic concerns of the patient, but greatly improve breathing as well. As you can see, dental photography has become invaluable in helping us diagnose and plan treatment for patients and has greatly improved communication because now my patient can see what I see and can influence the treatment plan and the decision making along the way. By walking through these pictures step by step, the patient actually understands a lot more where the issues are and where they came from and is able to help influence their treatment options. Thank you for watching and don't forget to subscribe.